All right, happy 2025, everybody. I hope you had a wonderful holiday season. Welcome back to Daily Dose with Danny. Today, we're going to be talking about how business owners can lower their health insurance costs. A lot of businesses just renewed their benefits January 1st, so you're probably thinking, why are we talking about this already for 2026? Well, this is where the work starts for your 2026 health insurance premiums. There's three lines of defense to lowering your health insurance costs. But first, you have to shift your focus. It sounds ironic because we're talking about health insurance costs, but shifting your mindset from health insurance to health care, that is how you lower your health insurance costs. When you shift your focus from health insurance to health care, you're able to open up a lot more opportunity to save money. First line of defense, focus on prevention. This would be through screenings or wellness checkups, focusing on nutrition and what you're putting in your body, as well as exercise. These are all encompassed within a good wellness program that you can offer to your employees. Doing so, you will see, and it will be a lag measure, the benefits of implementing this program. But we know that it's inevitable. There are going to be people that need to use the healthcare system and use their health insurance policy. When they do consume, make educated consumers of your employees. How can you do this? One way to do this is through steering them to independent facilities. Hospitals tend to have a good hold of the market in your local areas. This is because they have primary care offices. They might have emergency rooms attached to them. They might have imaging centers or labs. If you can find independent facilities for these different services, you will more likely than not save money. So make sure to check your area for high quality independent facilities. When it comes to your prescriptions, it's not a game changer, but using apps like CleverRx or GoodRx could save you a little bit of money as an employee. Another way through prescriptions is through Mark Cuban's platform, Cost Plus Drugs. Mark Cuban is looking to cut out the middleman, the PBM, the pharmacy benefit manager, to lower prescription costs for the population. He's doing this with very transparent pricing. It's the manufacturing price plus a 15% profit plus a $5 prescription labor cost and a $5 shipping fee. Add that together, that's your cost. If you are self-funded, maybe you're in a captive or even level funding, ask the question, where was this prescription sourced? Sometimes you're able to find that a name brand prescription can be outsourced from another country, Canada or Israel or New Zealand. All right, the third line of defense, they just consumed healthcare, health insurance. Again, it's inevitable, but the fight does not stop there. While this third line of defense is a little bit more personalized per employee rather than a group setting, you can still empower employees to fight their medical bills. Never Pay the First Bill, amazing book by the late Marshall Allen, great human being, great advocate and thought leader in the healthcare space. Never pay the first bill, as the name implies. Your employees should always be checking for their explanation of benefits. This outlines what insurance covered and what insurance did not cover. They should always be asking for an itemized bill. This is a line item by line item of every single service they received and the cost associated with that service, not just a summary of the total billed amount. They should also look for a machine readable file or a charge master. This Excel sheet shows your gross cost, your negotiated cost, your cash discount, the maximum and the minimum charged amount that they're allowed to charge for every single CPT code through a bunch of different insurance carriers. Having access to this file will show you where did they overcharge? Where did the negotiated rate not meet what it's supposed to for your insurance? Thirdly, your employees should be checking for unbundling and upcoding from their provider for the services they received. These are two strategies that providers will use to try to squeeze more money out of you. All in all three lines of defense can help you as an employer save money through your utilization of health care. By doing this, you will then in turn help your health insurance renewal rates for next year. I hope this video was helpful. Stay tuned for the next one. Thanks.